Africa is mobilizing to take decisive control of its own health future amid a worsening landscape of rising outbreaks and sharp cuts in foreign aid. The Africa Center for Disease Control and Prevention made this declaration during a media briefing officially announcing the 4th International Conference on Public Health in Africa. The conference, with the theme Moving Towards Self-Reliance to Achieve Universal Health Coverage and Health Security in Africa, is co-hosted by the Africa Centers for Disease Control and Prevention and the Government of South Africa in collaboration with Africa Bio's 8th Annual Bio-Africa Convention, expected to come on in Durban, South Africa from October 22 to 25, 2025. Speaking at the media briefing, Director General of Africa CDC, Dr. Jean Cphia underscored the critical need for the change, noting that for years, African health systems have relied on external financial and logistical support, as this model, he said, is no longer tenable.
Since 2021, foreign assistance for health in Africa has dropped by nearly 70%. It means hospitals without essential supplies, communities left without clinics, health workers losing their jobs. Many African countries are burdened with shrinking fiscal space and rising debt cost. But we are not powerless. Across the continent, governments are taking strong, bold actions. The Accra Initiative, complementing the Africa Health Financing in a New Era, launched by Africa CDC, are clearly showing a pathway towards sustainable financing of health.
Professor Oli Shisana, President of Evidence-Based Solutions, framed the current challenge as a defining opportunity for the continent, serving as an opportunity for Africa to lead, shape, and define its own health future.
Africa is facing a surge in outbreaks, a decline in aid, and health systems pushed to their limits. However, this moment is not just a crisis. It is an opportunity for Africa to lead, shape, and define its own health future. Cphia 2025 is where shared crises become shared opportunities. And it is where Africa's voice, rooted in evidence, experience, and innovation, takes its rightful place at the center of global health decision-making.
A central pillar of the self-reliance strategy is local manufacturing of health products. Africa currently imports a staggering 90% of its required medicines and vaccines. Dr. Nilanla Somi, President of Africa Bio, spoke passionately about the continent's untapped intellectual capital and resources, emphasizing that African innovation must be driven by Africans to solve African problems, which are often overlooked by global markets.
Conference or convention will bring together all the stakeholders who have the levers to the different verticals that we need towards pushing for innovation-led industrialization. And I think I want to underline industrialization. When we speak of manufacturing in the continent, we have to start speaking about manufacturing using innovation that is de novo, that's developed in the continent, because that's the only way you get to address local solutions.
The conference will also focus on domestic financing reforms, seeking concrete strategies to boost the average health funding provided by African governments, which currently sits at only 7%, far below the 15% target set by the Abuja Declaration.